about 20 people on the call. And the topic today is VisionRefer, something that we actually created in Florida as a solution for referrals. And VisionServe Alliance asked if they could appropriate it and share it nationally. So we're going to be talking about that. We will have time at the end for some questions and even other topics if you want to bring that up. But I want to ask, Ben, can you look at the list of participants and tell me, is everybody people that you know from VisionRefer? I guess what I'm looking for is, does anybody need me to just give a little background about what that is before Ben jumps in? What do you think, Ben? Are there unfamiliar folks on the list?
I would maybe give your short elevator pitch.
Okay.
Yeah.
All right. So years ago, in speaking with optometrists and ophthalmologists in Central Florida, where I was working at Lighthouse Central Florida, one of the docs suggested that it was too complicated for large eye care practices, especially in the state of Florida, to know which lighthouse they should be referring patients to. Because in Florida, we're very blessed and we have 18 private providers that cover every county in the state. And so if you can imagine, if you're a large eye care practice, it's possible that you're serving an area with patients that extends beyond the lighthouse boundaries. And so he said, wouldn't it be great if you guys just came up with some kind of easy button for us just to make one referral and it would go wherever it needed to. So I went back to my IT team at Lighthouse Works and Lighthouse Central Florida and suggested that. And lo and behold, a few months later, they came up with a prototype and shared it with ASB and the members of Florida organizations over the rest of that year, and massaged it into a very simple, initially it was a ticketing system that just based on the client's address, a doctor could input a referral, and based on that address, it would be automatically routed to the private community-based organization that served that area. Once we moved it to VisionServe Alliance with the help and permission of the state of Florida and Lighthouse, it took on some additional work to be able to work nationally, and it became a little more complicated. Ben is our coordinator at VisionServe Alliance. And last year we had, was it last year? It feels like 10 years ago. Was that last year when we had the last summit?
That was July 19th, yeah.
Wow. Doesn't that feel like a long time ago, people?
Last year was 5 years ago, yeah.
We had an in-person summit for all the VisionRefer users at Lighthouse Works in Orlando. And we just talked about what was working, what's not working, what else would you like this to do? And Lighthouse Works is still the developer behind this tool. So anytime we have upgrades or improvements, VisionServe Alliance pays Lighthouse Works, who gives us a very generous rate. I mean, they've been very kind to this project for us to make those upgrades, but it still costs money. And so we are now at a place where we've been using it for a while. We have how many users, how many organizations, Ben?
40, 1/3 of the membership.
And Ben, and we need to decide next steps. Are you guys liking it? What's working, what's not? Is there anybody out there who's on the call or members of VisionServe who's not using it that's interested? We can be creative with this, but we also need to figure out what its future is and who's the best home for it, who's going to pay for it, etc. So we want to make sure we want to know from those of you who are actually using it.
Is this still just a few states? It was Florida and Oklahoma and what?
So Ben will share with you, I think, where everybody is as part of his presentation.
Yeah, so I believe we're in about 11 to 13 states. I can't remember the exact number. Yeah,
Okay.
we're good spread across the states.
Okay. I didn't know that.
Yeah, so Ben, you're going to share some more demographic information too, right, as you talk?
Uh-huh.
Okay, good. So I'm going to turn it over to Ben. He's going to give a little overview, first of all, of the tool for those of you that are unfamiliar. And then he's going to give it some information about, where we're at, what we're accomplishing with it, and then he will open it up for discussion. So Ben, take it away.
All right. Thank you, Lee. I love that my title changes every time that you introduce me.
What did I call you this time?
You called me a coordinator of VisionRefer.
Oh, well, that's other duties as assigned. That's not his title.
Of course. I am officially the VisionRefer admin, so I do all the day-to-day operations. I believe a few weeks ago you called me creative director of something, which I'm more than happy to have all these titles, but I'm going to go ahead and share my screen here. I'm going to do just a very brief overview. Most of you have seen this at some point, whether doing training with me or are using it day to day, so you don't need an in-depth. For those that have not used this before, I'm just going to move this over here. For those of you who have not used VisionRefer before, this will just kind of give you a basic idea. But again, it is just supposed to be the easy button. It's supposed to be a very simple system to facilitate digital referrals that would replace the old way of doing it, whether that's printing out a piece of paper, filling it out by hand and faxing it in, or getting a digital PDF, filling out all this patient information and then sending it in, either printed out through fax or sending it through some kind of digital portal. So I'm just going to start with the whole life of the referral. So logging in here, this is visionrefer.org. It's a website. There's nothing to download. There's no program, no software sitting on your computer. It's all on the web. You log in with a doctor's credentials, and the only thing you need to sign up is a name, address, email, phone number, and then you set a password. And that's all you need to do to sign in as a doctor or a referring office. And so here's what they see on their screen, and I'll be as audio descriptive as I can. In the middle of the screen is one giant button, and it just says refer a client, 2 big arrows pointed towards it. If you scroll a little bit farther down, you see the last 4 referrals sent through under a title Recent Referrals, and then a button in the lower right that says Referral History, which will show you every referral that's been sent. To send a referral, very easy. You just hit the big button, Refer a Client. This is going to open up a big page with a few fields to fill in. Very first one is Refer a Client, Refer Client to, and this is going to be your preferred agency. So if you have an organization you have a relationship with, you can set them as your preferred agency, and you're going to be able to send your referral directly to them. You don't have to worry about the system. There's also a little drop down that lets you to say, let VisionRefer decide, and this will go through the system. The system is going to use the client's address, which is state, city, county, zip code. It's also going to use their date of birth for age range of services, and that's how it's going to refer to who's the closest and most appropriate organization for this to go to. So whoever's closest, and making sure that whoever that is it's going to does serve children or adults or working age, whatnot. So the basic demographics like we saw there. Email is now no longer required for those of you that requested that. We've removed that requirement, and that seems to have eased some frustration. And then there's a secondary field for contact information. That's going to be parent, guardian, family member, other, someone to contact for scheduling, whatnot. They can put it in there. And then a couple of referred services. So these aren't what the system determines where they should go, but these are just some, I'm blanking. I'm completely blanking. These are some suggestions for the provider that they're sending it to. That'd be your organization. And so that just kind of gets you an idea of what they're looking for, maybe what they've expressed to their eye care physician. And then there's an open text box that you can just type any directions or special considerations, whether that's a language barrier, a need for transportation, additional medical issues such as dementia or, blind and deaf, or, they can type in whatever they like there, just to give you a little more information on the patient. The doctor fills out their name. And then the big one here is there's a document uploader. So the idea is to trying to get healthcare professionals to upload, a driver's license, a copy of the insurance card, and then maybe an eye care report, or possibly their entire electronic health record from their system directly into yours. So you can just download it yourself and be able to have it in your system. So once you put that all in, you send it all off. I didn't actually type anything in there, if you can see that. But you're then going to see this latest one, and I have one sitting here pending as John Doe, and it went to our test for the blind account. And you can see that their status is different colors. So when it's initially assigned to somebody, it's sitting in the pending category. That means it's been sent to your organization. You have not received it. You've not looked at the referral yet, but it's been assigned to somebody. Then it goes down to receive. That means when you've accepted it, but you haven't done anything with the patient. Then you've provided services, some level, any level of services is the next status. Then completed services, that's you're no longer providing day-to-day or weekly statuses. And then there's a decline status service, which we don't have displayed here, but anyone who you've contacted after receiving the referral and they're no longer interested in getting vision rehab, life skills, independent skills. And again, this is your referral history here. And you can see all of the contacts. So this is what the doctor's saying. This is not what you're seeing as an organization. I just wanted to show you just a quick go through of that. The other thing I also want to mention, and this is something we're sending out to our referring accounts here, is under profile in the upper right-hand corner menu. You can edit your organization's name, contact information, but you can also edit that preferred agency. So by default, that's turned off because most doctors or referring users don't know where to send it to. But if you already have a relationship or you want to make sure that they're sending all of their referrals to you, you can send them over to this profile where they can select from a drop-down of all of our providers in a list here. I have this one going automatically to our test account since we're sending test referrals. And they're always going to have that option to select that anytime they send a referral. So the referral's been sent off. You're now receiving an email as the organization that says a new referral has been sent to you. Log into VisionRefer.com or VisionRefer.org to view it. So it's going to prompt you to come over here and log in. It's the same portal that the doctors are logging in at, VisionRefer.org. And now you've got 3 buttons on your dashboard as you log in. New referrals, ready to process referrals, and processed referrals. And they have little numbers in the upper right-hand corner of how many are waiting in that category. So we have a referral sitting on new referrals category. It's got a 1 in the upper right-hand. So we click on that button. And now you can see all the referrals that have been sent to you, who sent it to you, like the doctor's name, and then the basic information of the patient. Patient's name, their street address, their county, their phone number, and their date of birth, as well as a client ID. I do want to mention at this point that as an admin, all of this information is hidden from my side. So I can only see the client ID, their date of birth, and the city and state that they live in. I can't see pretty much anything else. So I can't see their street address. I don't see their name. I can't see any of the files that the doctors upload. So at any point you're talking with me about an issue with the referral, just use that client ID and I'll be able to reference it a lot easier. Please don't send me patient information. We've had an issue with that in the past. I don't need to know it. I'm just here to facilitate the technical side. So you've gotten this new referral. The doctor it's been assigned to you. You now click this green received button on the right side. This now alerts the doctor's side that this referral has been accepted into your organization, that you're going to do something with it. That's contacting them, that's looking over the files, checking in to make sure this patient is going to get some kind of services or at least provided the opportunity to receive them. So it's going to move it out of this new referral section, which once we've clicked received, it disappeared from the screen, and it moved to the button immediately to the right, which is ready to process. In ready to process, you now have the ability to open up the full details of the referral. So you click the details button, the green button on the right side, and it's going to open up that referral that we just saw from the doctor's side, but now it's all filled out. The only difference is there's a new box at the top that says current status, and you get to change that. Again, the statuses are received, contacted, provided services, completed services, and declined services. And as you update that and click update, the doctor is also going to get that notice on their side. They're going to be able to see where in the process the referral is, whether they're being contacted, whether they decline services, so that the doctor gets some feedback on what kind of services are being provided. Again, you can view all the client's information, go through the different notes, and then at the very bottom, you can see, who is referred to, who referred to you, what the doctor's name is, and what date and time they sent it to you, as well as the files uploaded by the doctor. So here I just have a bunch of the VisionRefer materials that are uploaded there, but this would be eye care reports, driver's licenses, things like that. The other new box that's been added at the bottom is this comment section. And this is a two-way comment section. So if you type notes in here, the doctor is going to be able to see them. If the doctor types notes on his side of the referral, you're going to be able to see them. So if any information needs to be updated, say they didn't have the eye care report, or they forgot that there's a phone number for a family member they wanted to include, the doctor can type, I'm adding this file, I'm adding this comment, and you can now see that. On the same side, you can say, we contacted them and we have them scheduled to come in next week. The doctor's also going to be able to see that on their referral. So it's a two-way dynamic box here where each comment is viewable. So that helps strengthen and build the relationship between you and the provider so that it's not just they send something off and hope they get taken care of. Now they can see their status in the process. They can see any comments you type in. They can see if they're being scheduled, things like that. And then you can get updates from the doctor if they forget to send something with the referral. So that is the big details here. So again, as you change the status of your patient, once you move it into provided or completed, and click update, and then you go back to your dashboard here, that moves it into the processed referrals. These are referrals that you're not actively contacting, trying to make new clients, trying to make new connections or schedule them. These are ones that are just sitting in your database. They're not going to be deleted. They're always going to be here, and you can reference them at any time, clicking on the details button next to each referral. That's the green button on the right here. You can go back in and view the referral, any notes that you've made or the doctor has made, review any of the files, but they're sitting in a new category so that you don't have, last year's referrals mixed in with this month's referrals. So that's the major features. There are a few others I don't want to go too deep into. You can pull reports on your account. So you can pull a report on the doctors that have referred to you, and then a list of every referral that's been sent to you as an Excel file so that you can import it into your CRM or EMR system. You can send a referral yourself. So this is in the case when someone walks through your doors, they're looking for a service you don't provide, but maybe there's another provider in your area using VisionRefer. You can actually type in their information and send it to them securely. Obviously, that doesn't fit every model. Some of you don't have providers near you, but you can. And then we have a resource center. And this one we're still building out a bit, but we've got our marketing materials in here, and those are also in the Google Drive, which is the link to it is in the chat. And these are just some suggested materials you can use. We're adding some presentation materials and also some training videos. We've gotten a little behind on these videos as COVID-19 has kind of turned the world upside down, and we've had to pivot to a couple of other virtual things. But that is the basics of VisionRefer. So at the moment, we have about a third of our users using a third of our members using VisionRefer, about 40. And doctors, I think we're somewhere around 70 to 80 last I checked. And that is referring in 11 to 13. I can't remember what the exact count was as of last week. But we're spread out in California, Vermont, New Hampshire, Oklahoma, Missouri, South Carolina, others, obviously. We've sent we're getting close to 675 referrals that have gone through so far. Of those, we've only had 4 that have been misassigned by the system. And that's because there was an issue with how the system was built. We fixed, that was about a year ago. So the system works. It connects you to the right place. It gets you to the right organization. And how you sign up is an organization has to talk to me because every provider has to be vetted by us. At the moment, it's only open to VisionServe Alliance members. But I'll create a login with you. I will train you on how to use the system. I'll get your staff, set up in there as additional users, and then you can start receiving referrals as you share it with your local providers, the ones in your cities, the ones you already have relationships with, and any new ones. So that's the basics of VisionRefer. I want to open it up very briefly here just for the technical questions for those that have not used this before or are using it and are just a little confused on maybe features or functions. Just a short start there, and then we'll jump into a little more specific questions, and then we can kind of just open it up for everyone at the end there. But does anyone have any questions right off the bat? This would be a bad time for you to tell me I've been muted this whole time.
You're not muted.
I know I talked very fast there.
Wow, no questions.
Well, I'll ask a question if
Go ahead, Ellie.
I didn't want to. Oh, if you have a question, Kirby, go ahead, because my question is a little bit tangential.
Ben, I was just wondering, there was a lot of information that the doctor's office has to fill out. Is all of those fields required, or is there just, some of that that's required?
At bare minimum, you have to put in their name, address, phone number, and a birthday. That's it.
Okay, thanks.
Yes, sir. So
Ben,
essentially,
Anita.
yeah. Hi, Anita.
Hi, honey. I'm sorry to interrupt you. Is there a way to maybe mark that with an asterisk or something so the doctor knows that at a minimum that's all they have to?
So there are asterisks next to them.
There are. Okay.
They're now that you mention it, though, they are a bit small, so I can see about increasing those size.
Hey, these are eye doctors.
Yeah, that's another feature, is that it gives a feedback to the eye doctor about their own vision. We haven't mentioned that before.
There you go. Yeah, there's a benefit right there. The asterisks are small.
I have a compliment. Our state has an online system that we're required to put clients into, everybody, but we still have to send a release for information and get the eye report. And this system is great because the doctor that sent us probably over 70 attaches the eye reports, and we're good to go. We print it out, have the eye report, set up the intake, and take off. So it is wonderful.
Thanks, Cheryl.
Ben, this is
Question?
Jackie.
Oh, go ahead.
Oh, I'm sorry.
No, go ahead.
Okay. I have a question for you.
Uh-huh.
I'm trying to think. So our organization currently already uses an online portal for our doctors to refer directly to us.
Mm-hmm.
So I'm trying to determine if there would be advantages of using this system over the system that we're currently using. Could you, does anything come to mind in terms of how the system might be more effective than what we're currently doing?
Sure. So the system that you're using right now, is it get a document from your website, fill it out, and then upload it to your website or email it?
It's an online form, so it's similar
Okay.
to what you have. In which they enter information, and then it generates a notice to us that there's been submission of an online form.
Sure. Yeah, I think the major benefit I'd see between that system and ours is this kind of facilitates that relationship of, kind of two-way communication. So the doctor gets some feedback on where the patient is. Now, some doctors don't care about that. They send a referral. They trust that you're going to take care of them, and that's fine. But some are, they want a little more feedback. They want to know a little bit more about where their patient is, especially these smaller practices where it is kind of a tight-knit, connection between the patient and the doctor. And so this is kind of a way to demonstrate the continuity of care between their medical practice and your rehab practice.
Yeah, that's a great point. Thank you.
I can think of a couple of other possible advantages. I'm not fully clear on exactly what your system already does, Jackie, but does your system encourage the doctor to send you eye reports? Is that benefit?
Yeah, we do have Yeah, we do have the ability within that, and that's one thing, because it's our own system. We've kind of customized it in terms of the information that we want the doctor to provide. So that to me is one challenge I see, in that because this is a shared system that's being used across, you know, all of the participants, some of the individual customization might be a challenge.
Sure.
But
Unless other people would agree, because we have
Yeah.
made changes in the past. And then
Yeah,
the
that's true.
other thing that I was wondering, do you ever have the need to forward a referral that really should be handled by a different organization? Because this facilitates that too.
Yeah, I think that's a cool function. Very rarely do we have to do that. You know, we're really kind of the only game in town for the most part. But I do, you know, very occasionally there would be a time when we might need to do that. And I do think that's a really cool feature within the system. I like that a lot.
Yeah.
One of the features that I didn't anticipate that I like is we sit in Tampa near St. Pete, Orlando, Bascom Palmer, and Miami, and our patients hop around. They hear Dr. So-and-so is great in Miami, they take off, and I'm getting referrals from doctors I've never marketed in my own area. And they put it in, and then it goes to by zip code to whatever agency where they live. And you know, they don't always just stay in their hometown to see the doctors there.
That's cool. That's really
Yeah,
cool.
that's a good point.
Yeah, especially with Florida, there's also some snowbirds that come from, you know, farther up north in different states even. And so we can connect providers across the different states to send their information securely rather than, you know, faxing it over, mailing it over to them, you know, every 6 months when they move between houses. I think to the other point that I was going to make, by the way, I forgot to introduce Ellie. Ellie is our liaison for Florida, and she has been working with all of the 17 agencies down there, 16 agencies down there.
Well, we have 17 that are members, and then there's a couple that are not of our consortium.
Well, 17 VisionServe Alliance members to coordinate across the states, across the cities, to get doctors on board, to facilitate this in Florida, and she's done a wonderful job. So she is truly the authority when it looks at a statewide look of what it can do when the organizations work together and when the net is spread very wide.
Ellie, you got to tell them about the doctor you and I went to see in Winter Haven.
Yeah, I got to tell you. But first I wanted to mention one other thing, because Ben mentioned it already, but I'd like to give it a little bit more light, and that is the idea of continuity of care. Because for doctors that bill Medicare, they get points for continuity of care, and they get criticized if they don't have a continuity of care component to their patient care plan. And so they can use VisionRefer as a demonstration of that. They can probably also use your system, Jackie. I imagine that they would, but that's something that I think is an important feature to mention to doctors who are considering going with this, or to the patient management staff that they have, because you rarely end up talking to a doctor. But Cheryl and I did end up talking to a doctor. He has since retired, right, Cheryl? What was he, 95 years old? We have a picture of him together. This guy was sharp. We walked in, but he had no preparation for us coming in. We walked in and got in a conversation with him. He started telling us all these different things. And he picked up a book that was about an inch thick, and he said, turn to page 425, and what I'm telling you about is referenced right there. And I opened up the book, whatever page it was he told me to turn to, and there was exactly the reference to the care story that he was giving to us. He was just amazing.
I was glad Ellie was with me, because when that 95-year-old man showed up at the door, I probably would have passed out if I was by myself.
He was terrific. It was a great experience.
I have a quick
I would
question.
be interested to know what people are doing right now during COVID, if anybody's having any cool ways of reaching out to doctors to add them to the referring pool, because we haven't done anything since early this year because of that.
Yeah,
We
and
were
also
quite a bit of traveling.
I think Lauren Becker had a question.
Thank you. Yeah, a quick question. So I'm located in California. Is the service currently being provided there as well?
It is. We have 3 organizations currently using it in California, who
Okay.
I'm trying to remember off the top of my head. One of the things you can do, actually, let me share my screen again. On the VisionRefer homepage, it has every organization that's currently providing through it listed under providers here.
Okay.
So you can search by state. Let's go to California. So we have
Lauren,
the
You're not sharing your screen yet.
Oh, I'm
I'm
sorry.
with
Am I not?
Braille Institute.
Braille Institute. Okay,
Braille
so
Institute? Yeah,
Braille Institute is currently not using it.
Yeah.
but you can sign up.
Yes, you
Easy
can.
So would the doctor's offices also have to sign up and be a member, or no? Is it just us that would have to?
So they don't have to sign up as members, but they do have to make an account, which is
Okay.
very simple, very easy. They can do that completely automated on their own.
Mhm.
There's a create account button on the main login page. A component of VisionRefer is getting the people in your local area on board. So whether that's doctors you're already receiving referrals from and sharing it with them, or marketing it to new doctors,
Okay.
that is a component of starting with VisionRefer.
Okay.
Now, we have plenty of materials, presentations, marketing plans, the whole 9 yards to help you along with that. And we have plenty of people that have been doing it for the last year and a half that can give you plenty of good advice to help along as well.
Okay. Perfect. Thank you so much.
Yeah. In California, though, it's Earl Baum Center, Lighthouse San Francisco, Society for the Blind Sacramento, and Valley Center for the Blind.
Okay.
So 4
thank you.
agencies.
Well, that's cool, Ben. Maybe I'll talk to you offline, because I'm feeling kind of stymied that I used to be traveling around the state a lot, and I would always spend an extra couple of days or a day and a half visiting doctors whenever I visited one of our member agencies to try and either touch base back again with those that have become members or to encourage additional members. And I feel like I've just totally lost all kinds of momentum there. So maybe offline I'll talk to you and see if maybe I can start doing something remotely.
Sure. Yeah,
I'm glad you mentioned that.
absolutely.
Yes, stay home. Your county was #1 today for the highest number.
Oh,
I know I'm probably a silent killer.
God.
So I think that prompts me to probably about these training videos and demo videos. I think that probably needs to be more of a priority for us from VisionServe Alliance, so that you do have a resource. You can just email them, or have a phone call and then connect them with some resources so that they can kind of see it in action. Obviously, we want everyone to be safe.
That'd be awesome. If I could email something out, I could email it to all the ophthalmologists in the state, just through our relationship with Florida Society of Ophthalmology.
Absolutely.
That would be awesome.
Yes.
What
and
a
obviously
great leap forward.
Under normal circumstances, I think it's far better to be, boots on the ground, but obviously we're not in normal circumstances. So let me see if we can generate those.
Yeah.
So how about anyone's responses to what Ellie asked? How are your referrals over these last few months? How has this situation impacted referrals from eye doctors?
Ours shut down just for a little bit, but the main referring doctor for several agencies is back. She's been back for a month or two, and they're starting to come back in.
Good.
I think April was bad.
Mm-hmm.
And I had a call from Ohio, from Toledo, Ohio. I think it was last week, and I gave them your information because this was a low vision clinic there that was interested in being able to use VisionRefer to make referrals. I don't know how they found out about it, but they were very eager to become, one of the referring organizations. And I sent them to you. Did they happen to call you? Does that ring a bell?
You sent them to Ben?
Mm-hmm. Yeah, I didn't know if Ohio was a state that was already using VisionRefer. Is Ohio using it?
Not at the moment that I can think of at the top of my head.
John Mitchell's organization isn't using it?
Look, there's somebody on the chat. That's the person I think that I'm talking about.
Oh, that's CABVI.
Oh, this is, oh, well, cool. I'll try and find that person.
That's right. I'm sorry. I've got so many organizations using it at the moment. I lose track.
Good, the Site Center of Northwest Ohio, that's perfect.
Yeah.
So it was a low, Danny, that was a low vision center in Toledo. So you probably don't have a whole lot of those, do you? You're on mute if you're up talking. Maybe I should just type the answer here. Okay, so you're the lonely low vision. Okay, so that, all right. So that's the people who wanted to know, Ben.
Okay. All right. So we'll get
I
some
thought that was the name.
information.
The name is familiar, so I must be thinking about this right. I don't always remember names too well.
Good. I'm glad somebody loves it. Well, more than one, hopefully.
Okay, she loves it. Okay, so
Ben,
Yes.
Ben,
Other
this
Ben.
is- Ben, this is Sherry from San Francisco Lighthouse.
Yes. Hi.
Hi, are we going to have time to discuss the question that I emailed to you about how to get the base, our doctor base set up? We talked. You were just talking about resources of how to reach out to ophthalmologists, and because we've got, I mean, like, okay, so it is pandemic time, and to go out and go to doctor's offices and things like that. I mean, I've reached out to the California Academy of Ophthalmology to find out how I can get lists of doctor's offices, and they can't share their information with me. So without like just going to the quote unquote yellow pages, how have people reached out to doctors' offices and made their database of reaching out to doctors' offices to get them to know about VisionRefer? I mean, this is a brilliant tool for referral, and we're so anxious to get it rolling, and we have been a member, but we just are not up and running.
Sure. That's a great question. I want to open that up to those of you that have been marketing it. You probably have more experience than I do on this. Growing that database of doctors. How do you get that initial connection?
Ellie, how have you done it? I'm surprised that
I'm
you
listening.
picked the list.
Yeah, the first thing I did was I asked our member agencies who were the doctors who are already referring to them using the old system of faxes. And I used that as my starting point. But then, I mean, if I was just driving down the road on the way to one of those, if I saw another ophthalmological or optometric practice, I just walked in. And my first contact, that cold contact, it was unlikely I was going to be able to talk to anybody because they're busy. So I would just ask to meet, just for a second, the office manager or the practice manager. And if I couldn't do that, then I would get the business card and I would call and email them afterwards. And the next time I was in town, which would maybe a few months later, I would make an appointment. And then with an appointment, I could sit next to them and I could demonstrate on my laptop the system and get them to really understand it and be interested. But we also had handouts, which VisionServe Alliance has excellent materials to share to entice them, besides having the direct experience with it on the laptop. But once you show it to them on the laptop, that's really the most convincing thing, because it's a web-based system. It does not impact, they don't have to worry about their IT department getting upset. And with the big practices, a lot of times they can't make a decision on their own. They have to go through legal, or they have to go through the IT department. So if you can skip the IT department and just get them to go through their legal department, you're going to be a little bit ahead, but it does slow things down a lot with the big practices.
But there's not that opportunity to do that now in the pandemic. And so I'm sorry, I missed your first name because you're listed as Ben Lee.
Yeah, this is Sherry Albers. I'm the
Sherry.
outreach coordinator at Lighthouse
Yeah.
San Francisco.
So Sherry, did you say that you asked the California Association of Ophthalmologists or Optometrists for
The
a list
the
they wouldn't give it to
California Academy of Eye Care Providers and Professionals. Yeah, and
That's
they won't
great.
share with me their list of members.
That just seems unbelievable to me. I mean, it was our Society of Ophthalmology in the state that wanted us so desperately to do this so that their doctors could be connected to services.
You
Maybe
know,
it
and
They haven't given us the list, though. What they've done is they have shared the materials for us. They let us have a free space advertisement in their monthly newsletter or their quarterly newsletter, and they have shared the information out. And if we go through them, they will arrange for us, for example, to speak to one of their regional. Florida is a big state, so they have regional societies underneath the Florida Society of Ophthalmology, and they can arrange for that. They just have to do it for you.
Okay, so that is the discussion I am in the middle of having with the vice president or the executive, somebody there. So I will just keep pursuing that. And I thought that was going to be like a wonderful resource to reach everybody in the state, even though we're only really serving the Bay Area right now. So I'll just keep pursuing that. Thank you.
Yeah, I had a board member that does marketing for her bank, and she was able to pull a list of all the ophthalmologists and optometrists in the area. And
Okay.
say, if you have some way to get in that angle, I don't know how she did it. I was glad to get it.
Well, that's a good point, because we've also had great assistance from the regional representative for Eschenbach. And so they have a huge database for themselves and salespeople. And so they've been helpful to us too.
Yeah, thanks for bringing that up, Ellie. Actually, a number of our corporate partners have offered to assist with this, like Vanda Pharmaceuticals also. So if you have a relationship with Orcam, IRA, probably more so Orcam, Vanda, Eschenbach, they have offered to carry that message and may be able to share info with you as well.
Interesting. Thank you.
I'm sure that you have a list.
Backdoor action.
Yeah.
So in conclusion, Sherry, everyone's more helpful than California. So I want to transition us just a little bit, unless someone had a specific question, and just asking about frustrations of the site and things you'd like to see different for the future. For those that have used it, and for those that have just seen it for the first time today, is there a gaping hole that we might be missing here?
No gaping hole, but you did say, where should it live? And I think it's living in a very good place. And you're doing a great job.
I appreciate it, Cheryl. She's the VisionRefer cheerleader for us.
Yes.
Yeah, thanks for that. If nobody else brings up anything, I'll just expand on that a little bit. Why we're even
know the holes, yeah.
Yeah. So it's our belief that in order for this system to be as robust as possible, we need to have many more providers on both ends, but especially vision rehabilitation providers involved in this, because I think the ultimate vision is that this will be the one-stop shopping or the go-to referral source for all eye care practitioners, that there's one place to go. It doesn't matter where they are in the country. They can enter their patient's information, and it's going to go to a vision rehabilitation provider. We only have 40 or so organizations participating. And even if we had every single VisionServe Alliance member who provides vision rehabilitation services involved, we still do have gaping holes in this country where there are no rehab services provided by our members. Even if we had every nonprofit organization that provides those, whether they're VisionServe Alliance members or not, we'd still have large swaths of the country where there is no service. Now, maybe we'll all figure out how to change that with remote services, but right now there's holes. And so I'm of the belief that one day this needs to include everybody, whether they're for-profit or not-for-profit. And in that case, does it still make sense for VisionServe Alliance to administer this? If so, we could possibly do that and charge fees of the for-profit organizations to participate. Or does it live at AAO or, you know, Eschenbach or one of the private providers? Cheryl's shaking her head no. Oh, see, you got job security, Ben.
There you go.
Okay, that's the discussion we're trying to think through.
He's good about watching it, and I started out being the one to come to so I could monitor referrals, and I have to admit I got very behind, and he was very nice and gently said, would you like me to assign it to somebody else? And I just don't see it. I said, yes, I would. I don't see an AOA or Eschenbach or somebody else taking the vested interest for the agencies and the doctors.
Well, I think that we would lose that for sure.
I'd also like to remind, well, because not everybody's from Florida, and I think for the group from Florida, we forget that one of the main purposes of even starting something like this was to allow us to gather data, because numbers being reported we know are not accurate.
Yes, that's true. And we have not really analyzed any of that, so we still have time to do that.
And to get the referrals ourselves, because sometimes they get lost or they never make it our way if they go to the state office. And so I love this system, and like I said, the biggest plus to me is it comes with an eye report, and we're good to go.
Okay, good.
Of course, you do have to educate the doctors when you meet with them to send the eye report, because that's an important part of it.
Yeah, so that's part of the difficulty is a lot of education comes along with VisionRefer. It's not hard to learn how to use it, but part of the education is for the doctors. Why should I refer at all? You know, we've been doing this for 25, 30, 40 years, and I haven't been worrying about referrals all that time. Why should I start now? But then also, as a lot of, doctors, they just hate change, so even if they have been referring, they don't want to go to something that's not fax. Now, unfortunately, fax is not secure, and as we grow more and more in the HITECH Act and the HIPAA laws, that's going to become less and less acceptable. So, yeah.
Well, and at the end of the day, we all know it's their tech that does it. So you really got to get to their tech because they're the ones that are going to take the time to create the account and send us the referral.
Right.
Absolutely. So I created a brief marketing plan here for VisionRefer. This is in the Google Drive. I'm going to go ahead and share my screen here. And it just goes through the whole process between, setting up your account, connecting a link on your website. But at the very bottom here, we've got the highlights and the barriers. So the big things for VisionRefer, especially now, is virtual referrals for remote services and telehealth. And let me know if I need to zoom in on my screen here.
No, it's good.
Okay. The other thing is HIPAA compliant. So we have a BAA certification with the Microsoft Azure platform, which is what VisionRefer is built on top of, which is HIPAA compliant. It's High Tech Act compliant. And then our team at Lighthouse Works are visually impaired themselves, so it's 100% accessible on top of that as well. So it's programmed by people who are, screen reader users and whatnot. And then again, it's that dynamic referral between office and rehab for continuity of care. It's a very simple system. You can just type in name, address, contact information, birthday, and walk away if you really want to. And then it cuts down on that patient health information recreation. So I worked in the medical field before coming here, and I remember how often I had to take a medical report and then retype it in and then recreate it here and then print it out there. And I've got 5 different reports with pretty much the same information on there. So this is kind of cutting out that, instead of recreating a whole eye care report with every medical condition, every medication, every, this and that, it just kind of gets that relationship started with referring the patient. So those are the highlights. Those are the big things right now. And all of that is helpful for, a pandemic time, because it can be accessed from anywhere. Whether you're on your home computer and you want to check in on a referral, or you're at your office and you're not seeing patients. So while you're sitting in front of your Zoom call doing telehealth, you can just be typing in the referral, whatever it is, it's all accessible digitally. Now, the big barriers to overcome are doctors don't like change. That's just a fact we have to deal with and get around. New platforms can be scary, whether it's of concern about security, or whether it's just, we've been using this one, let's not change. And then the initial concern about HIPAA and security issues. Now, we are obviously fully compliant, but you kind of have to work with them to help ease their fear of that. And then for a lot of larger practices, there's some red tape involved with that. You've got to get some higher ups on board. You've got to get not just the doctors on board to refer, but you might have to get a business manager or an office manager that's higher up to kind of accept that this is a new practice. So the major way to overcome these is obviously education, and I think it really starts with that office manager or that business manager. So building that relationship with the person that's kind of facilitating the office, and that's the initial kind of contact. You can obviously meet with doctors and they can get excited about it as well. But if you can get an organization level manager to kind of be on board, that's a big step to transitioning a practice into using this. And then later down the line, it's going to be that front desk person, getting them on board, because most of the time doctors aren't handwriting out the referrals. They're handing it off to a nurse or a tech or, the office manager to fill it out and send it. And so getting the education on their side as well. So if that means a lunch and learn, once they're on board with it, to get their techs together and show them how to do the process or whatnot, that's kind of the big steps, is get that organization level manager to be excited about using it with the practice, not just individual doctors. And then later down the line, helping with the education of the tech so that they know how to use it, so that they can just have it as their daily function.
Well, one of the things that really excited me about what you said before, Ben, is because what my ultimate hope was that I would get enough doctors in Florida to adopt this, that I could then get those doctors to talk to their peers at a meeting and say, I'm using VisionRefer and this is why, and I really encourage you to do the same. Now that we're talking about this virtual life that we're living in, if VisionRefer, if VisionServe can make a video that I can pop in a piece from one of my referring doctors in Florida, or anybody, it probably doesn't even have to be a Florida doctor, but I think in our case, it would help if it was a Florida doctor, and probably other states would prefer to have one of their own doctors. If I can get 1 or 2 doctors, whether it's a slide that's popped in, or if it's an actual live person talking and saying, I'm Dr. So-and-so, you probably know me from my practice on the west coast of Florida, because a lot of, like on the west coast in particular, they have offices in 5 different locations that span between north of Tampa to the south of Sarasota. It's the same doctor, and their practice manager is the north of Tampa, and then you end up talking to somebody in South south, and they said, no, my practice manager's in north. Anyway, the point is, if I could get that, and if I could email out this video, this 1 minute video, and it had that doctor saying I'm using it, I think that would make a huge difference.
That's a great idea.
Yeah.
So maybe Cheryl or you, Ellie, or you, Anissa, one of you can recommend a doctor who's a big fan, and
Yeah,
do
we've
a
got
virtual.
some big fans. And I know Cheryl has some, and I'm sure
And
Lisa does.
Lisa
So-
does.
Make a
Yeah.
virtual introduction to us, if you will, and get that ball rolling, and Ben can reach out and arrange a recording or
For a
something.
little 5-second interview,
Yeah. Mhm.
a testimonial.
Absolutely.
Okay, we're going to work on that, right, Cheryl and Anissa? I think you're the only 2 Florida people on the phone right now. Carol's on the phone too, but Carol has a different situation because she's got a relationship that they've created with their local doctors for a long
Yeah,
time.
Lisa
But in
Howard.
any event,
Lisa Howard would be good too.
yeah, I know. I had her in my mind. I was just looking to see if she was on the phone.
Yeah, but there's a doctor that serves several areas around here, and she's a referring machine, and I know she would talk to you.
Okay, good. I'm really happy about this.
Great.
So we're coming close to our time here. So I just typed my email into the chat. That's B as in boy, LEIGH at VisionServeAlliance.org for those of you on the phone. Send me an email if you have questions, comments, concerns, you have resources, or you want resources, get in contact with me. I'd love to have this conversation farther. Yeah. So thank you all very much for listening to us talk.
And for all
Thank
the
you.
great work you do. Thank you so much.
Thank you.
And
Bye,
Kirby,
everybody.
I will connect with you individually. I just saw your message here.
Yeah.
Ellie,
All right.
don't forget we have a public hearing now. And
I know. I'm going to pop off and get on it.
Okay. Adios.
Thanks so much, everybody.
Thanks, everybody.